Hi everyone. Last time we talked about post-COVID conditions, and I mentioned two things kind of briefly, myocarditis and pericarditis. I wanted to dig a little bit deeper into those today and also talk a little bit about blood clots and a little more about pacing. Um, the myocarditis, as you'll remember, is inflammation of the heart muscle itself. Pericarditis is inflammation of that lining around the heart. The problem with these two conditions is that they can be silent. And by silent, I mean that you might not actually have any symptoms, yet they be going on in your body. Sometimes they will create chest pain and other symptoms. And obviously, if you have anything like that, go see your doctor, get any referrals that you need, cardiologist. But sometimes, again, and a lot of times, you don't have any symptoms, so you have no way of knowing that something's going on. So in those cases, it's still very important to go see your doctor, get the testing. EKG can help out, and there's other blood work, like a blood work with troponin levels can kind of tell you if there's been any damage to the heart as well. So getting some of those things done, that's going to be a good thing so you know how to pace activity later. And again, we'll discuss that a little more in depth in a couple minutes. Also, with blood clots, I want to talk about them. It's not uncommon, doesn't happen to everyone, but it's fairly common to have some very small blood clots throughout your lungs just because of the way that COVID can affect your respiratory system. And it could create a blood clot anywhere else. You never know where it's going to be. You can get a blood clot after you have a surgery, especially like a total knee or a total hip. Again, they're pretty uncommon in those cases. The doctors take precautions to try to prevent them. Different medications are used to try to prevent them too. And if needed, you'll keep an eye on their PTINR to see how thick or how thin their blood is, and also how long it takes for it to clot. Another test that can be done, and one that was done for me in the hospital, is a D-dimer. That kind of can give you some information about your risk for a clot too, especially if you have COVID. So those are some things to kind of look out for. So like after those total joint surgeries, the clot tends to occur in the calf. A lot of times people are fine, and then it's kind of like all of a sudden it's there. And some of the symptoms you'll notice in that case is that they didn't have pain with weight bearing before in their calf. Now they do, and then also if they pull their foot back, dorsiflex their ankle, they'll tend to have that pain there as well. So with COVID, it's probably not going to affect the calf, so it's not going to be quite as easy to figure out if you have that blood clot or not. So further testing can help out there. Even though x-rays may say that the pneumonia that you have, if you do have it from COVID, is not that bad, still might be a good idea to have a CT scan. It just gives you a better picture of things, and you might find some things there, and they might see some microemboli, so some very small blood clots. One of the reasons we want to be real careful with a blood clot is that it can break off, and then it can travel anywhere in our body. And it can get stuck in some of the very small blood vessels too. And so, it's possible for a blood clot to break off, travel to our brain, get stuck in some of the small vessels there, and lead to a stroke. Or it could break off, travel to our heart, get stuck in some of the small blood vessels there, and lead to a heart attack. Of course, these are things that we don't want, and we want to avoid them if we possibly can. And so again, just kind of get things checked out to make sure. And so all of this kind of brings us to the pacing. I've been going very slow with what I've been able to do, and I have been able to do more each day, but I haven't had any symptom exacerbation. Everything's felt good. If I would start to feel tired, or if my heart rate was getting too high, I would just stop, sit down, or whatever else. And so it's real important to do it that way, because again, that myopericarditis could be silent. Sometimes the blood clots, they're silent too. You don't necessarily know that you have them there. And so just by taking that kind of easy approach, we do avoid, at least as best we can, having any further issues later, creating any damage, anything along those lines. And so, I probably could have progressed more quickly. And so I would have shot up, but I probably would have got about here, and then I would have plateaued and probably not gotten any further, at least for a while. I would have also increased my risk for having, post-COVID conditions. Sometimes those issues or those symptoms don't even show up for like a couple of months after the infection. So far I haven't had any symptoms, but I do know that's still a possibility, and that's why I'm still taking things real easy. But the other problem with kind of that shooting up, it's similar to this kind of boom bust example that I'll share with a lot of my patients that have, chronic pain, what'll happen is, they have pain, so their activity level naturally comes down. The body's got kind of this set level for where it's going to protect you, so kind of your activity level's kept here so that you don't go past that and create any tissue damage or anything along those lines. Well, if you've been down here because of pain, a lot of people, they get tired of it, and so they're like, I'm going to just do things today. And so that level's here, and so they'll just bust through that level, do too much, then their body pays for it, and they come down and normally below where they were before. Well, it takes them a few days to recover, and then they want to do it again. But unfortunately, the body's still trying to protect them, so normally what it'll do is it'll lower that protective level down even more. Now they bust through and they only get here, and they go back down, and then the body lowers down again. So you can see over time that's actually going to lead to them being able to do less and not more. What I want them to do is more of the pacing approach, to where that tissue protect level is here, their activity level's here. We just kind of slowly build up, and we just kind of nudge that line. We don't bust through it. We don't necessarily go up and touch it. We just get kind of close, maybe touch just slightly, just to kind of nudge. And over time, that line will start going up. They can do a little bit more. It goes up, and they can do a little bit more. But we got to do that gradually, and we got to do that in a way that the body doesn't, and the brain, they don't perceive a threat. And so this is what pacing is. It's just taking that nice, gradual, easy approach, and eventually you pass by where you would have got to quickly, and you move way past it. So I'm willing to move slow right now, instead of coming back, maybe getting one of my climbing projects done quickly, but then staying at that level. I'd rather take this long-term approach, get my projects done a little bit later down the road, but then be able to go beyond that, get more, moon board benchmarks, and get more climbs outside and move up in that V9, V10 range. So I hope you guys learned something from this. Please like and subscribe, share the video with people that you think might like it or might need it. I hope you guys put some comments in. If you have any questions, I'd love to hear them, or topics for other videos too. I do plan to do some videos talking about what functional medicine is. A lot of people don't know, so that way we can just kind of share what it's like and what to expect and what it is hoping to accomplish. I also want to share some, climbing videos, and maybe even some exercise videos here and there, like your different workouts I do to help with climbing too. So hope you guys have a great day. Thank you.